New types of chemotherapy can help treat cancers in the abdomen. Joining me to explain how the procedure works, Dr. Brett Schipper, Chief of Surgical Oncology at Hartford Hospital and the Hospital of Central Connecticut and Director of Oncologic Surgery at Hartford Healthcare Cancer Institute. That's a mouthful. Welcome.
Thank you very much for having me.
All right, Dr. Schipper, tell us about this so-called new surgery. What is it? How does it work? What's it called?
It's called HIPEC, or heated intraperitoneal chemotherapy, and it's actually been around for a little while, but there aren't many places in the country that do it. It's a specific treatment we use for patients with stage 4 metastatic cancer in order to treat the cancer. In stage 4 cancer in the abdomen, it tends to coat the organs and the different tissues, so this surgery has two parts. The first part is debulking, or removing all the visible cancer, and the second part is putting heated chemotherapy into the abdomen, washing it around the abdominal cavity for 90 minutes, trying to kill any cancer cells that may be left behind.
All right, what types of cancers does it treat and how effective is it?
Yeah, that's a great question. So there's only limited types of cancers that we use it with. Things like appendiceal cancer, colon cancer, ovarian cancer, and mesothelioma are the main types. There is some studies going on in other types like gastric cancer. The survival benefit really varies on the type of cancer and the specific nuances of those cancers, but we have some patients who get years of disease-free interval out of this treatment. And sometimes if it does come back in a few years, we can go ahead and do the treatment a second time and sometimes even a third time.
Is everybody who has these types of cancer a candidate for this type of procedure?
Not everybody. First of all, you have to be in good enough physical shape to undergo the operation. So there's certain preoperative clearances to make sure your heart's okay, your lungs okay, your kidneys, that you're otherwise safe for surgery. And then the other piece is you have to have the disease confined to your abdominal cavity. So unfortunately, if you have disease in, say, your lungs or your brain or other organs outside of the abdominal cavity, unfortunately, you're not a candidate.
All right, and what are the benefits? Better recovery times?
Yeah, the benefits of this is that the chemotherapy gets directly to the tumors. Unfortunately, regular systemic chemotherapy or IV chemotherapy has a hard time getting to those tumors that are on the linings of organs or the lining of the abdominal cavity. So this treatment takes the chemotherapy and puts it directly on the tumors to try and kill them.
All right, sounds terrific for those who are facing this. Dr. Brett Schipper, thanks so much.
Thank you so much.